So, South, to you and your team, on behalf of the Fijian government and the Ministry of Health and Medical Services, I would like to take this opportunity once again, to extend our utmost appreciation and gratitude to you and your team for your contribution and generosity towards improving the health services sector. And I believe the renovation of this ward has taken close to about $11,000. Okay, so thank you very much. And of course, it's not only about money. It's about the commitment. It's about the willpower. It's about how you feel towards the project. And ANZ has led the way in terms of this. I have been informed that similar renovation works had been done at the hospital in the previous years, and through this recent renovation, you have once again demonstrated sustainability in your commitment to uplift the services provided to not only Savusavu but our other facilities, like you mentioned, will be in Lambasa to do the handing over of the refurbished labour ward. On that note, if I can also say that the Ministry also carried out renovation works in 2014 at the hospital with re-roofing an existing corridor and other renovations, which was valued at about 73,000. And again, I've mentioned major maintenance work budget has been given to the Ministry in this year's budget, and our plan includes the general maintenance of sub-divisional hospitals in the Northern Division, namely Nambawalu, for which the work is expected to be undertaken in the current financial year, followed by some works here at Savusavu Hospital and Taviuni Sub-Divisional Hospital as we progress. So good news for the Northern health facilities. Ladies and gentlemen, like I said, despite the criticisms and challenges encountered by the Ministry in making progress, we are determined and we are really determined to go beyond our means to take our services to a new level, and this is where the teamwork comes in. Okay? The work that you do at your level, the work that you do at your level, the work that we do at our level has to be a teamwork. Then only will we be able to achieve our vision. And we will continue to pursue this goal, and we will not be deterred in our endeavors to serve the people of Fiji with the best of our abilities. Sadly, ladies and gentlemen, those that make negative comments for political mileage see the health only as far as 10 years back, when in fact these health issues have existed for decades and there isn't any quick fix solution to the problems we have. In trying to do our work and take our work to another level, we are partnering with NPOs, we are partnering with faith-based organizations, we are partnering with civil society organizations, we are partnering with corporate bodies, and like I said, we are progressing. You are aware that our vision is creating a healthy population. Now when we talk about healthy population, how do we create a healthy population? We end up serving a lot of our people at our health facilities, but the problems that come to our doorsteps are bred where? In the homes, yes. That brings us to NCDs. That's the biggest challenge that we in the Pacific, especially we in Fiji, are facing. And we cannot stop talking about NCDs because we've reached a crisis level. We've reached a crisis level when it comes to NCDs, and we get a lot of blame. Okay, our facilities, the medicine, we sort of get all this blame. But I think as medical professionals, whether you're a nurse, whether you're a doctor, we need to educate our people on the need to lead healthy lifestyles. Half of our problems would probably be gone if people started taking more responsibility. If people started taking more ownership of the health, which sort of is a gap, okay, between what happens at the home, at the community, and what happens at the health centers. So we need to make very, very positive interventions when it comes to getting people to eat right. When we say eat right, the amount also matters, right? The amount, what we eat, the amount of what we eat also matters. So your advice to your patients is very important, very, very important. Okay? But my concern always is, how do we get people to manage? We can continue to upgrade facilities, we can continue to upgrade, bring in doctors, we can continue to make more facilities. Is that the solution? It might be a solution partly, giving people access to health facilities, but it's not going to solve the problem of NCDs. Encouraging people to grow their own food, encouraging people to take regular exercises, encouraging people to burn up those extra calories that we put because our plate is sort of big. You know, these are some of the things that that you need to promote as well. So I guess what we need to do now is put our hands together and say thank you, ANZ. I'll leave you with this. South, thank you very much. Thank you for the advice you've given to the team. We'll take special note of that advice. Okay. And to Team Savusavu, Dr. Tiko, okay, thank you very much. SDMO, thank you very much. The Board of Visitors, thank you very much. Staff, thank you very much. Keep looking after your patients. This is your facility, and keep doing what you do because you know how to do it right. I don't come from the medical profession. I can't tell you. I can provide all the support you need, but you do what you do best. Okay? Keep your patients happy, keep them smiling, and smile yourself, and enjoy Savusavu.